Hello, everyone, and welcome to The Great Couch. We will discuss all things ABA, entrepreneurship, and lifestyle. We have a very special series that is dedicated to parents as well as parents of children with special needs. Today, I am extremely excited to have Dr. Yolanda Lewis-Ragland join us on The Great Couch to discuss autism, development, and nutrition. So again, thank you so much, Dr. Yolanda, for joining us today. I was wondering, can you please tell us about yourself?
Yes. So first of all, thank you for having me. My name is Dr. Yolanda Lewis-Ragland. I like to go by Dr. Yolanda. It's very familiar. Just to sort of let people know that, we're in this together and we're partnering as a parent and a physician. I am a pediatrician. I'm actually double board certified. I'm a board certified pediatrician as well as a board certified bariatrician. And what bariatrics is, just so you know, is that it's the medical management of weight loss. So bariatric surgeons do surgery. I really talk about nutrition, ways that you can get your weight managed using supplements and meal plans and things like that. So as a pediatrician, though, I have been at Children's National Medical Center for 14 years. A mom of 3 kids. I have a 21-year-old who's a senior in college at Tulane University, and my son is 18 now. He'll be a freshman at Morehouse whenever Atlanta opens back up. And my youngest daughter is 15. She's a sophomore, just transferred to Bishop McNamara High School. So besides being a pediatrician, I'm also a mom. So very keenly aware of development and what development looks like and what it should look like, and applying it to my own kids as I was going through my training. So that's just a little bit about me. There's authored a couple of books on nutrition. One is actually a children's book as well called Naomi Negotiates a Healthy Lunch. And just excited to be here and in any way sort of be an advocate for communities in learning and understanding how to best take care of their loved ones, themselves, or their children specifically. So so I'm excited about the conversation.
Yes, me too. And thank you so much. You have so many wonderful accolades, and I just, I'm just so honored to have you. So I know you just started off with just generally speaking about the development of children overall, as well as with your practicum and learning, and then comparing that to the development of your own kids. So can you tell us a little bit more about what does child development look like? I would say probably between the ages of about infancy to maybe 10.
Yeah, sure. So normal child development, what do we need to expect? Most people will recognize and understand that once they have a child, even if you're an adopted parent, right? There's some norms that you should be familiar with. So a kid should, at the beginning, so what we do is we look at development. It's funny that you say 0 to 10, but as a physician, that's like really old, because I look at it from what are they doing in the first week? What are they doing by 2? What are they doing by month 1, and then 2 months, and then 6 months. So we actually really expect certain milestones, we call them, to be hit at a certain age. So basically between 0 and 2, a baby is cooing. That's their way of communicating. There are no actual words being said, but there should be some sounds being made. A baby who may not be cooing or making any sounds may actually not be hearing sounds. And so you want to be concerned if you have a baby that doesn't really make a lot of audible sounds themselves, they're not really imitating things that they're hearing. Cooing, smiling at just about anything. You can make a baby smile. You can make them really kind of engage you and interact at those first couple of months. And that should be with anyone. That's actually even strangers. They're not really, they don't discriminate from parents and siblings and people in their house from strangers. So they'll see a stranger go by, and the stranger will make a face at them and they'll smile at them. But that's up until about 2 months. And then you say between 2 and 4 months. And let me be clear. There's a whole bunch of things we're looking at. So in order to make this, a little bit easier to understand, there are 4 parts that we're looking at: motor skills. And in the motor skills, you got fine motor skills, and then you got gross motor skills. So are you able to, grab something fully with your hand, or, are you able to do things with just your fingers? But that's a little bit later. But we're looking at fine motor skills, gross motor skills, communication, and then the way that they perceive and interact. So one of the things is we're just kind of talk about communication, since we're really sort of focusing on autism, and that's where the breakdown is for autism, is sort of that interaction and ability to communicate and interact with others. So at up to 2 months of age, they're cooing. That's their way of communicating. After that, they may start making razzles with their raspberries, with their lips. So when you see the little bubbles being made, they're blowing bubbles. They're really drooling a lot because they're teething. That's actually an important step, because they're starting to figure out how to make a B sound. So they're making these like bubbles with their mouth, and they're really practicing how these sounds are going to be made with their lips. And so as they're still very interactive, you're going to notice that you may be able to play, hide and seek, hide some things from them, and they're extremely happy about it. You hide your face and show it to them. They're extremely happy about it. And then up to about 6 months, you're starting to hear maybe like double sounds with the babbling, not words, but just double sounds with babblings. And really, so within the first year, it's mostly trying to figure out what words that you're saying. They're not going to say them back. One of the things we talk about with communication is you should be able to understand about 50% of what a stranger should be able to understand about 50% of what a 2-year-old is saying, 75% of what a 3-year-old is saying, and 100% of what a 4-year-old is saying. So it goes in sort of quarters, right?
Yeah.
A parent, however, might understand a little more, because there's some gestures that might go with it. So they're pointing at stuff and they're saying the same sounding word, but it's not a true word, but they've sort of created a language. Sometimes as a parent, you need to know it's a little bit harder when you have twins, because twins will start to have their own language between themselves, and the parent is left out, and they're trying to figure out what they're saying, and they've created their own language. But that dissipates to about 4. Like I said, 3 or 4, everyone should understand them. But the whole idea is to know that they should be very interactive. They're excited about seeing you. They're excited about communicating with you. And what's important for parents is that you constantly talk to a child. You're in the grocery store, and the child's not going to talk back, but you're in the grocery store saying, "Oh, should we get some carrots today? I think I want to get some lettuce. I wonder if they have any milk. This is milk." You're talking to them constantly, because they're sponges. They're absorbing everything you're saying. And you just don't know when eventually that connection is going to be made, and they're going to say something back or respond and use the word. But that's why reading to a child from 6 months up is extremely important. Constantly reading, constantly sort of downloading information, so that they're able to sort of regurgitate at some point. So all of that's extremely important. Read to them, talk to them while you're in public. Share with them, not necessarily sit them in front of the television to have them just absorb, because that's not the same. There's not a lot of interaction with that. A lot of people will use television as babysitters, if you will, and it has to be done here or there. I get it, but for the most part, you really want to do as much interacting as you can. So
okay, so it seems like about that first year, or even between 1 to 4 is very crucial in a child's development.
Extremely. This is when, if they're not speaking back, we know to probably check their hearing. If they're not speaking back, because again, I'm telling you, they're a sponge. So if what I say back to you is a result of what's been said to me, that if I can't hear that, if I can't receive that information somehow, then that's going to be where the barrier is. And one of the things to know is it has nothing to do with language. So a kid whose family is bilingual at home is fine. The parents are speaking in Spanish or Amharic or Arabic or whatever at home on a constant basis. That child's still going to be speaking back at the same ages. The only time that there's a little bit of confusion is once they get in school, not because they aren't, they're unable to, but now they're sort of translating. In fact, they're pretty smart. They're translating sometimes from English into their native language back into, and so they may have a little bit of a delay, but after a while, that's not even noticeable. But yeah, 1 to 4, extremely important, because if a stranger doesn't understand your child's language by the time they're 4, we've probably missed something in their development in those first 4 years. And we don't want to wait until they're 4 to find out that we've missed something.
Right. Okay. Well, thank you so much. I learned so much just now. Awesome. So I know too that you'll be speaking to, you know, the diagnosis of autism, and I'm aware that there are some of those developmental milestones that are missing, or, you know, the child may have those skills and then all of a sudden they go away, or the child has regressed. So can you tell us first, like, what is autism, as well as maybe like what may be happening, whereas it seems that the child is developing normally and then all of a sudden there's a change?
Yeah, so that second question is a little loaded, because we're really still learning, right? Yeah. What it is, and or why it happens to some kids and it doesn't happen to others. You know, so many times parents want to know if they did something, if it was something that they sort of introduced, and so now they start scrutinizing their diet. They want to know if it was the vaccination, so they don't want to immunize anymore. And honestly, you know, studies have not proven that any of those things are causal, you know, this cause and effect for autism. First of all, it's a spectrum disorder, which also makes it very difficult, because when I say spectrum, I mean that there can be a very, very mild autistic like diagnosis in a child, or a pretty severe autistic diagnosis in a child. And so when you have autism, what happens is you have, there's a problem with the communication and interaction that you are expressing within the brain with anybody, with your environment, right? With people, with objects, it doesn't matter really. But what we do find out is that for some reason, there is a fixation on objects. There's an easier ability to manage and relate and try to deal with just your objects around you, because there's not a lot of expectations from these objects, right? And so you'll find that some people will say their child was, you know, oh, this is really cute. He likes to line up his cars and, you know, put them all straight in a line. But the obsession of that is if anyone touches the cars or puts them out of order at all, or they always have to be in the same specific order, there's almost an ODD, this compulsive nature to it, right? Obsessive OCD, rather, obsessive compulsive sort of arm to it, because there's a specific thing that they like to do all the time. Or they don't like to be touched in certain ways, or sounds will startle them in certain ways. And these aren't things that happen immediately. These are things that sort of, as you said, they'll have a normal development up until around 18 months of age. One of the things that you want to be really specific about as a parent is that you're taking them to the very regular appointments. We actually began looking for signs of autism by 9 months of age. 9 months of age, most kids aren't going to show autism, but they may show some peculiar ways in which they might not interact. I just told you that a baby loves to coo, and they like to play hide and seek, and they like for you, you know, that kid that'll keep dropping something and picking it up and dropping it, and they can 2 hours, and you're just, as a parent, you're like, okay, would you stop? But some kids don't want that type of interaction. They're easily like, you know, okay, done with you, and they'll move on. And so we can see that may be starting at a really early age, but around 9 months is when we start screening for development. But around 18 months that a parent, we do an actual autism screen called the MChat, and look for very specific things that they may have been doing that they have begun, begin not to do so well. They're sort of regressing. And then there's another disorder that I don't want to go way into that's more of a true regression, where even past 18 months, they're doing quite fine. And then around 2 or 3, there's a complete regression, and it's not really autism. It's actually something else that's more common in girls. But with autism, you'll find that they begin to have repetitive motions. They're obsessed with just objects at times, not very interactive with parents or even siblings or other kids their age. And noises can startle them more than usual, more than other kids. So it's not that noises don't startle kids, but it would be a little bit more drastic than it is for any other child. So you're always going to compare them to other kids. You're never going to, as a child, say, oh, this is what's going on with my kid. You're really comparing them to what's going on with the other children that are around, either in the daycare or at home or whatever setting that you can find. And so that's why parents who have an only child can have a hard time picking up on this. Right. And so you definitely want to follow along with your pediatrician as regularly as possible, because it's a pediatrician who sees a lot of other children. If you don't have your child in daycare, you don't have your child, and you don't have any other kids to compare, then you're not really aware. And look, COVID and things like that, some of us aren't even taking our kids out to playgrounds. We don't even have play dates anymore, right? So this is even a more important time to be following along with your pediatrician, so that somebody is aware if there's going to be any lag in their development, because the sooner we identify the lag and the sooner we get an intervention, the better the child. So the earlier you introduce treatment, the more likely you are to have them on the lower spectrum, which means they're more functional. Right. If we can get therapy early rather than
later. Okay. So I know that you mentioned for the scale that you all utilize, I believe you said it was the MChat. Is the earliest that a child can be diagnosed with autism 18 months? And then the other piece of that question is, how does a parent go about getting diagnosed?
So it isn't the earliest. So as I said, because it's a spectrum, there are kids, they're showing signs of autism well before 18 months because they're on a more severe spectrum. And so, by 1 year of age, they're pretty clear that, they don't like to be touched, don't want to be picked up, don't want to have, there's just a very specific behaviors that they can have. So it's not that we wait until 18 months, but child who's regularly developing, we give all kids the screening at 18 months.
Oh, okay.
Miss anyone. So that's not like, oh, this person thinks that their child may have a problem, let's give them the screen. No, it's an automatic screen for all kids at the age of 18 months. So that we can make sure we're, checking off what we need to have checked out. And you can always loop back and find out, oh, they were doing pretty well, or some of these. So sometimes the way the screen goes, there are some questions that are hard fails and some questions that are soft fails, right? So there's like a number that they'll pass by. And if they pass with sort of a soft pass, then clearly we're going to keep them on our radar. And we're going to continue to monitor this kid. If they have a hard fail, we're going to give them an immediate referral and intervention. And then we go from there. Parents seeking an actual diagnosis, if this is what they're concerned about, just have to let their pediatrician know that they're concerned. And then we do a developmental screen, and then we'll refer them to the development or a genetic, depends on what you have at your health center. Pretty much development and genetics or genetic development, sometimes they call it the same, is all in one department. So we'll have them screened by specialists, even outside of the pediatrician, so that they can be really specific about what spectrum they're on, you know, what their functionality is, what kind of intervention they need, how early they need the intervention. All of that is going to be determined outside of our office.
Okay. And once a family gets a diagnosis, as a pediatrician, what do you believe are maybe some of the pros or the cons, if any, to a family receiving a diagnosis?
So that's actually a really good question. So as a physician, I always feel that a diagnosis is better than not, because at least we have something that we're working with. Now, what I don't want people to do is accept a diagnosis as this diehard, you know, sentence as to this is my child's fate, and this is what, you know, they're gonna go down some particular road to what you think about whatever the diagnosis is. So with autism, the earlier you diagnose, the better, because your interventions start early, and then you can have a very mild form of autism based on when we find out what their functionality is. It means that as soon as you get a diagnosis, I think the pros are you get looped into services immediately, and to recognize that there's support systems and there are other parents that you have access to. Your school, if you're already associated with like a daycare or a child center, you now know that you're looking for specific services, and if they're not adept at your services, then you're going to go looking for a better environment for your child. So the sooner you have this information, I think the sooner you are armed to actually be an advocate for your child. I think sometimes the cons of a diagnosis is I think sometimes people will assume now that there are some limitations that this child has that the child really doesn't have, and they begin to place the limitations on them. So now they're, you know, we don't want them vaccinated, or we don't want them to do certain things. We don't want them in certain environments or around. And I think that sometimes limits the child, because the earlier the intervention happens, the more they're actually going to be functional. And so you may be doing more harm than good to sort of over protect them from certain things. I think that's just a time to know where you are and figure out which resources you need and really get people around you engaged, so everybody is on board.
Okay, thank you. And just to switch gears for a second, just talk about, you know, development and nutrition. Do you believe that nutrition has an impact on the way that a child develops, whether it be, you know, their brain functioning or just physical development?
So clearly, I believe, you know, I'm all about nutrition, right? Everybody knows I'm nutrition mission doc. So I think nutrition plays a huge role in so many things. And I'm talking autism, ADHD, anxiety, I mean, there's a lot of things that we don't really understand about food. First of all, even the word food is a loose term, because there are a lot of things that we have been allowed to market in our country that aren't even marketed in other countries. I lived in Africa for 2 years as a Peace Corps volunteer, and the amount of preservatives that are in the foods that we eat here are nowhere near that level in a lot of, people call these third world countries, but they're agriculturally driven, you know, it's natural food. So a lot of the colors, a lot of the preservatives, a lot of the really simple sugars, the chemically based sugars, are having a lot of effects on our brains, especially the brains of our children, even our unborn children. There are all these studies that show that even with pregnant women, they have to be careful about the foods they're eating, because it's actually affecting the brain development of your unborn child. What people don't realize as well is that our brains continue to develop until we're 2 years of age outside of the womb. Our brains are still developing. Our spinal cords are still developing this myelin sheath of protective this protective coating, as well as it has a lot of oils and fats. And so it's why for a young baby, we want them to have whole milk and not non-fat milk. They actually need the fat to actually produce the covering of the brain and the spinal cord and things like that. And so we're still developing that brain from 0, which is birth, to age 2. And if your child is walking around with Kool-Aid in their bottle, you know, as opposed to milk, and it doesn't have to be cow's milk. You know, I won't even go through, you know, how I feel about human and breast milk over formula and cow milk. But the point is, if all they're getting are these empty calories with sugar and color, that they're getting their nutrition from, versus something that has protein and fat and minerals and vitamins and, you know, this, then there's clearly going to be a difference between how this kid over here that's drinking Kool-Aid in their bottle and this kid over here that's drinking breast milk. There's going to be a huge difference in how they develop. There's a lot of studies that have shown that typically breastfed babies overall, even over formula and some of these other milks that we give, are better able to control their appetites because they're satiated, they know when to stop, and that cognitively, which means, you know, brain function and, if you will, intelligence for a child between 0 and 2, their cognitive skills are higher as well. So the substrate that you're giving a child from the beginning really does matter. And so one of the reasons health disparities is such a problem, food disparities is such a problem, economic disparities, having low income, being unemployed, or in an area of violence, because even the constant stress of domestic violence, hearing sirens outside of your home constantly, being all of that cortisol that builds up, and that also bathes your brain. Those are the things that we don't really talk about enough, and studies are just slowly starting to come out. The Deepest Well, Nadine Burke is a pediatrician who talks a lot about what we call ACEs, right? Adverse child episodes. But an adverse childhood episode is simply being hungry, right? Yeah. Not having enough to eat, having the wrong foods to eat. It's not just the fact that you're physically abused or, you know, or sexually abused, or so. It's really just not having enough or living in these very stressful areas. So all of that, I know we just talked about nutrition, but so many things really are extremely important when it comes to the development of a baby's brain, and then a toddler's brain. And then from there, that small child who's now school aged and who has to go to school and has to learn like everyone else, but they've gone to school on Fruity Pebbles and, you know, something where another kid has gone to school with, you know, scrambled eggs and spinach and feta and whatever you're going to make for breakfast. There's going to be a difference between how these kids are going to sit down and be prepared to learn. And so the same is with autism. I have a nurse that works with me, and her son is autistic, and she'll tell you the story. I'm actually going to connect you to, because I think that she'd be a great person to interview as a mom. As she's a nurse, but she's a mom who has a grown son who still has autism. She takes care of him. But she said she went to a school once where the principal, someone at the school told her to take her son off of gluten, first of all. She told him to take him off of gluten, and to take him off of a lot of chemically based preservatives. And she said it was like night and day. He would have these episodes. He would, and I say violent, I don't mean maliciously violent, just very agitated at times. Right. And she said when she changed his diet and hadn't changed anything else yet, he was a very different child. A milder mannerism, able to follow more instructions. He just really began to develop better. And so nutrition plays a huge role. We don't talk enough about it because there's not a lot of money in that. There's money in medications and some of these like outlandish therapies, and you know, but when we talk about just changing some diets and taking some things out, and, not doing bagels and toast. And, when we talk about that, sometimes people don't want to hear that part.
I need to change my diet. I'm like,
So, but but I think it's extremely important to have the information and decide whether you want to use it or not, but at least to have the information. So.
Awesome. So I know that, we just spoke, or you just spoke, I should say, a lot about the nutrition overall and autism. And, I know from my clinical experience with some of my clients, they may have very restrictive eating habits and maybe only eat, Fruity Pebbles, or only drink red juice, or only have chicken nuggets, and the chicken nuggets only can be from McDonald's, and like that's all the kids will eat. So what can parents do to help expand or increase their child's willingness to accept new foods, or just generally like getting in the nutrition? Because I know as well, sometimes clients that I service can be underweight just due to how restrictive their eating habits are.
That's such a good question. And that's why the sooner they're in therapy, the better, because that's what a lot of therapists are there working with, right? Occupational therapists, and so we call them we OTPT, right? So occupational and physical therapy, but occupational therapists are there to really help with sort of the everyday activities of a child or a patient in general. So what they're eating, what they won't eat, maybe allowing them to sort of play with textures in foods, and foods that are the same colors. Like you said, you may find out that they don't want red, they only do orange, or they might do yellow. And that's actually really, really true about autistic kids. And so you want to be able to, so I would definitely say get with an occupational therapist, preferably a nutritionist as well. And then you do a lot of hiding food. You do a lot of putting things in like, Boost and Pediasure are these liquid protein drinks that, I find parents making, putting in shakes or somehow grinding up vegetables. And I mean, you have to be so good at it, because an autistic kid is like, nope, I can taste it, or I can feel it, I can smell it, because they're so, they have such a keen, their senses are heightened because of some of the other things that they might lose. They're definitely spider senses. So they're very keen on very specific things. So making sure you have a therapist, getting a nutritionist, and finding out ways to get them to maybe do vitamins, whether they're gummies, whether they're liquid vitamins, ways to blend foods in, adding foods in other places that they wouldn't suspect. You have to just, you become really creative as a mom. In general, as a mom, we become creative, but definitely parents of autistic children, I commend them. My hats are off to them, because they learn so many things that we don't have to know as, just a regular parent. How to get their kids to do certain things and not do certain things, how to keep them calm and very agitated situations. And like I said, my hat off to so many of these parents and how well that they're doing. But what I love about getting a diagnosis too is that you also begin to develop a support system and parents who can tell you some of the things that they had to do with that they've successful at, and you would have never thought of, and you come back and go, okay, it worked, so it's really, really important to get a support group.
Awesome. Well, thank you so much. And I know that you mentioned at the start of our discussion today that you have a children's book that's dedicated to nutrition. Can you say the title again of the book, and people can get it? And
it's right here. I'm in my office. It's actually Naomi Negotiates a Healthy Lunch, and subtitle, Seasoned Pediatrician's Whimsical Introduction to Good Nutrition for Children and Their Parents. It's actually something that can be purchased right off of, I have a nutrition blog actually, bodydocpro.com. So Bodydoc is BODY DOCPRO. And I believe it's also on Amazon. So if you don't want to go to the nutrition blog, if you get it from there, I'm able to like see that you purchased it and autograph it and send how many you want. With Amazon, of course, it comes directly from the warehouse, so I don't have any involvement in that. But yeah, that's just, it was one of those things that as I wrote it, it was just about trying to figure out how to get parents and kids to see what are some of the pros and cons in what we're doing, sort of with the typical foods that we're giving kids. And it's as simple as giving a half a sandwich is important over a whole sandwich when it comes to portion control, when it comes to, you know. So there's a lot of little pieces of information in there that I think would be helpful as a parent, or it would have been helpful to me as a parent. So that's why I wrote the book.
Awesome. And do you also have something for parents as it relates to healthier eating habits? Maybe they can do a family thing or any.
You're gonna make me do the BAM thing, right? So I have my adult book. I had to put my thing on top of my book. So I actually wrote a book. I have a couple, but it's called Dr. Yolanda's Soul Food Therapy. And what is soul food? So soul stands for savory, organic, unprocessed living foods. So I really talk about how processed foods are causing problems, how foods that we're cooking until they're so overcooked that we don't have any nutrition left in them. I talk about ways in which if you spice up foods with herbs, then you don't have to add just salt and pepper. And not just salt and pepper, but salt, pepper, and sugar, because those are the three things that we tend to add. Pepper is fine, but it's the salt and the sugar that's killing us. And then I do a whole thing on organic. Do all foods have to be organic? What foods are better organic? Because, you know, that's the whole market in itself. And sometimes it can be extremely expensive.
Right.
What foods are most important to be organic? What does it mean to be organic? Is everything that says organic, you know, kind of stuff. And so we had that's a whole discussion. But yeah, so this is for adults. And then Naomi negotiates the healthy lunches for kids. And with that adult book, there's a journal with it. So if you're really actually doing it for weight loss, it takes you through just ways to create a meal plan, you know, what do portions look like, and how do you begin sort of exercising for yourself what portion control should be, and the difference between portion control for adults and portion control for children. I think so many adults just don't realize we don't know what a child's portion looks like. And so overfeeding our kids, we're giving them the same plate that, you know, our parents gave us as a kid, and we're saying, sit there and eat all your food. And actually we're overfeeding them. At times. So we want to know, what does that look like? So it's just a little bit of information about how to use nutrition to sort of obtain your optimal health. I believe it's 85% nutrition when it comes to most of what we're dealing with out here, especially a lot of our chronic diseases. We could honestly eliminate it if we were eating right.
Wow. Well, thank you so much, Dr. Yolanda. I think I'm going to have to bring you back for just something geared towards nutrition for maybe parents, because I know it can get stressful. I know me, at times I stress eat or on the go so much that I'm constantly in someone's drive-through, and then I pay for it later when I'm not feeling well.
And then COVID's not helping, right?
Yeah.
I mean, it truly is unprecedented times where what our treat for ourselves right now is to go something and bring it home. And I remember in the beginning when people were stuck home, they were cooking. After a while, they were like, oh, I'm not doing this. But they were also cooking all these comfort foods. They were hoping this was going to be over any day now. You know?
I think you were spying on me. No.
No, it was everybody's story. It's going to be over in a couple months, 6 months. Now that they realize this thing is a year and a half, they're like, oh, I got to actually go back to, you know, eating right and getting some exercise, because this, COVID weight is no joke.
Yeah, not at all, not at all. All right.
So I would love to be back. I have definitely people that, as we were talking, this is great, what you're doing. Parents need this, and you have done such a phenomenal job with just your outreach and just seeing it from a different perspective and really allowing parents to sit down and, and see the gray couch and have these discussions that are so timely and just sort of help them, navigate their daily lives. So it's just kudos for being an advocate, a very good advocate. I appreciate what you do. And yeah, anytime you need me, just let me know.
Well, thank you so much for your time again. I've learned so much, so I can only imagine, once parents or other professionals are able to, watch this, how much they'll also learn. So I know that you're so amazing at what you do, and I'm pretty sure that people want to get in contact with you. So do you have either social media, or I know you mentioned your blog, or, like a website where people can get connected with you?
Yeah, so if they want to email questions or anything to me, info at Dr. Yolanda, MD. I know it's redundant, but the MD is because some people out there call themselves doctors are not really physicians. So I'm really clear so that you do know that you're talking to a physician. My website is www.dryolandamd.com. On Instagram, I'm Dr. Yolanda, MD. On Twitter, I'm Dr. Yolanda, MD. The only one that I'm sort of my whole government name is on Facebook, and that's Yolanda Lewis-Ragland. But anybody who wants to contact me, you can get me through any of those, and I will respond. If you have any questions for me and you're connected to Nandi already, she'll go ahead and shoot me an email, and then I'll answer from there. So.
Awesome. Well, thank you again so much for your time today. It was lovely, and I will see you again soon.